All right. Hey guys, it's good to see you. I am going live right now just to talk about Damar Hamlin. Guys, this is unbelievable what we have seen tonight. I just went live on Facebook because I thought it was super important. Want to talk to you about the events that have transpired, what we know, and then from a physician, what some of my thoughts are about what might be going on. Okay, so Damar Hamlin, I'm just pulling up my notes because I really think it's important. I really want to get this right and sort of get everything. So pardon me if you see my eyes sort of darting off a little bit. Don't mind me, okay? All right, so let me get all of this ready here. Let's see here. First of all, we know Damar Hamlin. There was a game tonight, right? Okay, the game he plays for the Buffalo. Gosh, I'm trying to do this right. I had everything ready, and then like it just got crazy. So TikTokers, like, please don't get annoyed with me. Like, I know this is like really crazy, but all right, Buffalo Bills, Damar Hamlin, right? Collapsed during tonight's game against the Cincinnati Bengals. A lot of people saw that. A lot of people saw and was completely like, oh my gosh, like literally what is going on? And there has been kind of a lot going on. Let me see if I can do it this way. I think this is probably a little bit better. Okay, good. So hopefully you guys can all see me. Oh crap, y'all can't see me. Oh, there we go. Okay, sorry. All right, so okay, Cincinnati Bengals against Damar Hamlin's team, the Buffalo Bills. All right. So this is the thing. A lot of sports teams and sports players, or rather sports commentators shows have been replaying the play. And a lot of people are like, he didn't get hit in the neck, et cetera, et cetera. He collapses. According to CNN, he fell on his back on the field just moments after standing up following an open field tackle, Bengals wide receiver T. Higgins. Okay, so that's sort of the sequence of events. Basically, what has happened after that has been literally unbelievable, something I've never seen since then. And I'll just tell you the description. Then I'm going to tell you what the hypotheses are about what's actually going on with them. Sorry, I have a stuffy nose, so I apologize. And then also kind of what's going on right now. So, apparently, responsive emergency people were with him right away, which is great. He had people like his trainers. Actually, this is a report that the Buffalo Bills trainers actually got to Damar Hamlin literally within 10 seconds after he collapsed, which is awesome. When it comes to strokes, when it comes to heart issues or things like this, time is money, time is brain, time is heart. This is so important. And then apparently an ambulance was on the field less than 5 minutes after that. This is what some of the footage shows. So thank goodness for the quick response. He apparently received, and we saw this, immediate medical attention by the team and independent medical staff and local paramedics. This is according to the NFL. First of all, for those of you who watched the game, because I literally was watching Netflix and a lot of you guys were writing to me, hey, did you see what's going on with Damar Hamlin? Can you talk about that? Blah, blah, blah. Let me know in the comments if you saw this transpiring and what you felt and what was going on and how you were feeling and what you were thinking. Okay. Apparently, he had CPR done, and I saw some reports that he had an AED that was used, or at least someone got an AED. I'm going to talk about what an automated external defibrillator or AED is, as well as talking about what CPR is and how they are used. Then apparently he was gotten in the ambulance. By the way, I've never seen pictures like this of like on the football field. Again, I got to it late. So I was looking up the footage and stuff, and that football field was cleared out, and you literally see this ambulance backing up on a football field, and that is some scary stuff. I mean, right? When was the last time we saw that ambulance backing up, just looking for the play-by-play? And yes, ambulance back up. And I also saw a report too that the ambulance was taking off, but also took a moment to allow his mother apparently to, I guess, get in the ambulance, or they wanted to get the mother. Let me know if you know what exactly happened with that, but I know that there were some sort of details about that. The tackle apparently happened at 8:55 p.m. and he was he left the stadium in the ambulance at 9:25 p.m. This is according to CNN. Then I saw on Twitter, so that by this time I'm getting notes from you guys, and then I go to Twitter and I'm seeing all these people tweeting, hey, stop the game, stop the game. And I don't know if you guys saw this, but like, and let me know in the comments, guys. And again, I'm kind of a little cold, so that's why I'm stuffy. but it sounds like there was maybe a delay between when the game was decided to be stopped. I don't know. But anyway, they canceled the game, which was totally the right thing to do. I don't know if it took a long time for them to do that or what, because I kept seeing people being like, stop the game, stop the game, stop the game, and don't know if they fully did that. Okay, YouTube. I'm on YouTube too, so I'm just going to clear that off. Okay. All right, so now let's talk about a few things. Oh, and apparently Damar is right now in the hospital in critical condition. He is intubated, which means he has a tube down his throat to help with his breathing. Okay. Apparently a rep from his team, his like management team, said that his vitals are stable, or rather they've been returned to normal or something like that. But that he is in critical condition and he is intubated. All right. So this is the thing. I want to talk about a couple of things, because one of the reasons why I talk about health in the news is because hopefully it will give us a way to live a healthier life and to be mindful of what's happening in our life. And yes, one of you on TikTok, you're saying, this is my sign to learn CPR. Guys, and it's epic.throwaway. Thank you so much for that shout out. Let's first start talking about that, because you know what? This is all of our sign. This is for all of us. This is our sign to learn CPR. Let me tell you what the medical experts are saying happened. Okay. They're saying that he experienced, and this is from many of the doctors that I follow, I think are amazing, et cetera. Hold on. Let me pull up my description. I had all my notes here because I wanted to make sure I got it right. Well, hold on. Sorry, I literally have all these tabs open because, yeah. So one of the thoughts on the street by a lot of the doctors that I know, that I follow, that I trust, especially cardiologists, et cetera, sports medicine docs, are saying they think it may be something called commotio cordis. This is a condition where the heart basically goes into some like wacky rhythm, or person goes into cardiac arrest. It stops. It goes into some unsustainable rhythm due to blunt trauma to the chest. And a lot of cardiologists I know are saying that they think that this perhaps happened when he was on the field and he had that big blow that caused him to go into this condition called commotio cordis. Okay. I will say that with any medical condition, there are always a number of reasons why conditions can happen. So right now it's suspected that that's the case, but there are other reasons why somebody could pass out or collapse on a field. Okay. So just want to say that, although I really do trust the doctors and my colleagues that are out there talking about this and giving their expert opinion, I trust that. But commotio cordis, again, it's a theory that a lot of cardiologists and doctors have, that this blunt trauma to the chest caused his heart to go into cardiac arrest. Okay. Now let's talk just a little bit about CPR and AEDs, because this is perhaps the part I think that we can all take away from this. Besides, oh, and by the way, can we send out love and prayers, please, to Damar Hamlin and to his mother? Please write in the comments. Just send up like your favorite emoji, throw up a heart, put a prayer sign in the comments, like whatever your favorite emoji is. Please send prayers, because I do believe prayer works, and I think that, you know, God bless this child. And I can't even imagine what it must be like to see your child like go through this on the field. I was watching earlier Coy Wire, who used to play for the Buffalo Bills, who used to do HLN. He was on CNN, a sports commentator, like talking about it. And he literally, like, tears were in his eyes. He was talking about many different tragedies he's experienced with football colleagues over the years, having injuries and being paralyzed or things like that. I mean, the man almost broke down into tears. And it just reminds you that, you know, football, just like so many other sports and so many things, can be very dangerous. I'm not going to go into that discussion because that's, you know, outside of my wheelhouse as a doctor, right? And thank you guys for sending up prayers. I see you guys, and I so appreciate that. If that's the smallest thing, if that's all we can do here, then you know what, that's important. But yeah, so on a side note, before I talk about CPR and AEDs, there's a lot of discussion happening right now, appropriately so, about how dangerous football is, and are we doing enough, and is this right, and is it not right, and which we, you know, blah 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 blah, and that's appropriate, totally appropriate, right? Okay, so now let's go back to CPR and AED. So CPR, you understand, can be life-saving. It's this idea of helping someone that has collapsed, that you don't think is breathing, or their heart has stopped beating, to help them help their blood keep flowing. And that's literally what CPR does. Okay. It's used when a person stops breathing and their heart has stopped beating. And what CPR does, like when you're doing chest compressions, right? Like 30 chest compressions to 2 breaths. Check out the American Heart Association for classes. You could go to redcross.org. They do classes for like bystander CPR and stuff like that. If you don't know how to do CPR, I'm telling you, okay? And even if you don't have time to do a course, go on YouTube. And I'm not like this person who always says this, but I think I'm going to do a video on this too. I've done videos on like saving choking victims, but go on YouTube, look for Red Cross or the American Heart Association and look up videos that they may have, or doctors or medical centers, Cleveland Clinic or whatever, reputable places. Okay. But the idea with CPR is somebody's not breathing, their heart's not beating. You do compressions to keep the blood flowing because blood has oxygen. And if the blood doesn't flow because their heart has stopped beating, that blood can't go to the brain and other tissues and keep you alive. So you do CPR to kind of keep the blood moving in place of the heart that's not able to do that. And you do that until the ambulance comes or a medical team comes or you get the automated external defibrillator. Let's talk about that. AED, you've probably heard about these. These are in airports. These are at schools. These are at churches. These are on football fields. These are at shopping malls. These are everywhere. And you say, wait, what's that? And that is that thing where the paddles go on somebody and they get shocked. And believe it or not, people, everyday people can use these. In fact, the ones like I say on the street, like are designed for people to use who are not medical people. They literally have instructions that are big and bright and say, number one, do this. So what you do is the AED, let me just make sure. Okay, good. YouTubers, you guys are still with me. Okay. Cause I'm just over here talking like nobody's business. And I ain't even paying attention to make sure all the streaming is streaming right. Okay. So an AED, automated external defibrillator, right? Let's say somebody's in trouble. Somebody's doing CPR. You guys have called 911. Somebody needs to go and find a defibrillator to see if they can. You bring the defibrillator, and what that does is it's a computerized device that allows you to restart a heart that has stopped beating or is beating too quickly. It shocks the heart back into action so it can do the pumping appropriately. Okay. I mentioned that because there were reports that an AED was used. I don't know. Like, obviously, I wasn't there. And that's why I keep saying reports, because that's all we have. The most important thing here is to take note of the medical stuff that was happening so that we can use this information, hopefully to be a blessing to someone else. You know, people sometimes ask me why I talk about maybe celebrities and their heart. I talk about all health issues, but I, in particular, in addition to everything else, talk about celebrities, whether it's Kirstie Alley and her colon cancer or whatever the case is, because what it does is it helps teach us about our own lives and may give us a frame of reference to help us. The most important thing, like I said earlier, that needs to happen now. Let's see here. Favored by my father on TikTok. You said his vitals are back. They had to sedate him to get a breathing tube down his throat. Yes, I read that as well. Okay. Jackie H925. You said, do you think it was an underlying condition or the impact? And that's a great question. A lot of the cardiologists I'm hearing from are saying it's this heart condition. Commotio cordis. Did I get this right? Commotio cordis, which I don't even deal with, right? Because that's like a highly specialized heart condition. But the truth is, it could be a lot of things. So we really have to wait to see what's going on. Learn how to do CPR, even if it's just you and your family watching a reputable YouTube video. And by the way, guys, on YouTube, and I have this designation, doctors and allied health professionals that are totally legit on YouTube, we can apply for a certification where it says underneath videos, this is a real doctor, a real medical institution, meaning you could trust the information. Look for doctors and medical institutions that have that designation. I have that on my YouTube. For those of you who are on TikTok, hello, it's great to see you. I'm a real medical doctor. You can look up my MPI number and where I practice and all that good stuff, my medical school credentials. I teach a medical school course. It doesn't mean I'm right, okay? What it means is that I'm a legit doctor who does this. And yes, I make sure that I'm right, but I just need to say it because there's a lot of false information out there. Let me just refresh one more time just to see if there's any new updates that I miss. Okay, so yeah, this collapse. I'm just taking a look at the picture of the collapse. Apparently, and I know you guys know this, but he collapsed on the field. He fell on his back just moments after getting up from the tackle. Yeah, it's just unbelievable. So Hold your loved ones close. Okay. Learn how to do CPR, y'all. This is going to be an important story for us to follow because we need to hold him up and lift him up in prayer. For those of you who are new to me, I just say this because my job, in addition to being an associate professor at a med school, I take it very seriously, the idea of educating the public about health stuff. And I appreciate you being here. If you've not followed my TikTok channel, please do it. Dr. Jen Caudle, you guys are here. I appreciate the follows. Those of you who are watching me on YouTube, it just went live on Facebook, but I really thought this was super important. On YouTube, please subscribe to my channel. I do daily videos and all sorts of stuff. I appreciate all the support. Let's lift Damar Hamlin up in prayer. Let's follow this story. Let's be there for him and be there with him. And let's also make sure we know how to do CPR. We know about AEDs, and we are activated to act when we see someone is in trouble. Okay. It's upsetting. I'm not his doctor. I'm not his mom. I'm going to get off soon, but I just have to say this. It's really upsetting. And again, the sniffles are because I have a cold, but it's upsetting. So lots of prayers. Okay. I love you guys. Stay safe. Okay. Learn CPR, learn how to use an AED, keep your eyes out for it. I love you. We're going to lift him up in prayer. All right. All right, guys. Bye. Okay. All right. YouTube, it's good to see you guys. Okay. All right, loves.